heart of Malawi, where vibrant cultures and resilient communities thrive, a silent battle wages on. HIV and tuberculosis continue to claim lives, disproportionately affecting women and men across the region. Yet, in this landscape of challenge, a beacon of hope emerges. The Bridge the Gap initiative strives to transform this reality. Their mission? To reduce the incidence of HIV and TB by enhancing access to quality health services for all.
In Baraka district, there was a great experience on how we interacted with our friends from DREAM, Bridge the Gap project. We walked around the facilities across the district, supporting our clients as well as service providers. There were a lot of gaps that by our own at the Ministry of Health, Baraka DHO officers, we couldn't have managed to resort them. But through this Bridge the Gap project, we've seen the work becoming so easy. Number one, the staff from DREAM themselves, they were providing us transportation, and with this, the facilities that we were not able to meet them regularly, we were able to go each and every facility, almost each and every quarter. With this, our data is almost very clean. We are using it for making clinical decisions, and a lot of things are changing in the program because of this Bridge the Gap project. Apart from that, Bridging the Gap has also helped us easing the work by providing ECT materials to the number of facilities, including this facility where I am now. We have been provided with the computers and the data backup materials.
This laptop is helping us to process our HIV and TB data more easily in class and before. We also use it for making paper presentation, to paper creation, and also transferring data to Ministry of Health and district.
With this, we could see things that our providers could have tried to do them manually, taking a lot of time, but now the work has become so easy. In terms of reporting process, I can ask for a report from the facility today and it can find me even today. In terms of making presentation, it is becoming very easy for the facility to give us their presentation, because it's like they already have it typed in their computers, and they already analyze their data using Excel, whatever, at the facility level. These were only possible doing them at the district level, but now it's like the coming of the Bridging the Gap project has brought this technology closer to them, so as easing the HIV program and TB program services in this district.
It helps us in data analysis and data entry, and making presentation, on writing reports, and checking of staff returns.
On behalf of my fellow staff members of the Sviluppo, I'd like to say thank you to DREAM and the Bridge the Gap project for the support which they have provided to us by providing mentorship and some trainings to our member of staff, plus in the ICT materials which has helped us in so many ways, like in writing report and presentations, and also by transferring some data to another hospital, which has been so easy through this ICT material.
In the fight against HIV and TB, the safety of the health workers is paramount. Yet, in many regions, the lack of essential protective equipment hampers their ability to provide care without risk. A substantial donation of personal protective equipment was made to the Balaka District Health Office. This donation not only protects the frontline heroes, but also reinforces the healthcare system's resilience, ensuring that the medical staff can continue their life-saving work without compromising their own health.
As you know, DREAM is a partner to Ministry of Health here in Malawi and also in particular here in Balaka district. So it's our core mandate with this Bridge the Gap project, which we are working mainly focusing on the HIV, AIDS and TB services. So what we have done here today is like we are donating some PPEs like gloves, aprons, masks, and also needles, and also so many things. As you can see, the cartons are there, all worth about 4 million Malawi kwacha. So it's not the first time, but it's part and parcel of our project to support this district health office and also the facilities here in Balaka. As you know, Bridge the Gap project, we are mainly doing the mentorship activities in the 15 health facilities, including also doing some trainings to the staffs, that's capacity building, and also supporting them with this equipment. Like we also give them the ICT equipment, and today we are giving for the second time the PPEs. So yeah, it's part and parcel for our health office here in Balaka to work effectively and better to sustain giving quality care to clients or the patient within here in Malawi through Bridge the Gap project run by DREAM, funded by Italian Cooperation Agency.
As government, we are trying to provide best services to our clients, but as we are providing those services, we'll also be thinking of preventing the transmission of diseases. So this kind of PPEs will be helping protecting our health workers and also protecting our clients. As you can see, there is an interaction of patient and health care provider. So whenever they are providing services, we need to be cautious on the transmission and also spreading the disease. So this donation will really help us in service delivery. On behalf of the DHSS and the entire management, we really appreciate for this kind of donation. There are a lot of things here, I can be mentioning one by one, but we really appreciate for this. We are seeing disposable gloves, heavy duty gloves, which are very important whenever we are managing our patient and also protecting us from different kind of diseases. This is going to help us in providing best services to our clients and also protecting us from different kind of diseases. As government, we are trying to improve health status of our patients, but we can do that on our own. Also depend on such kind of donation to try to implement and also add efforts on what government is doing. I think there are many hospitals which would have closed, but you saw it right maybe to consider Balaka Decho. I think this is not the first time DREAM, Bridge the Gap, giving us such donation. We'll keep on looking forward for such donations, and we really appreciate for such a generosity. Thank you.
By adopting and evaluating gender-sensitive methodologies in key health units, Bridge the Gap aims to pave the way for equitable healthcare, where every individual, regardless of gender, can receive the support and treatment they need. Through a dual approach, the project seeks to fortify the capacity of health services in Balaka, ensuring a robust response to the HIV and TB pandemic. Crucially, it emphasizes a gender-sensitive strategy, recognizing that women and men face unique challenges and barriers in access to care.
On the special men's clinics, we offer different services like HIV testing as one way to reach the HTS strategy as the government wants 95, 95, 95. That 95% of the population that are positive must be tested, and 95% those who are tested HIV positive must be on the treatment, and 95% of those on the ART, their viral must be suppressed. So we are emphasizing our men to come to be tested for HIV testing. So we also giving them the different health educations on how they can take care of their families, like supporting on each other. Suppose the family is on a ARV treatment, they have to remind each other on how they can take the drugs properly. As also the men, they have to take the responsibility to be active participation on their health matters, to come here to the clinic when they feel that they are sick. Even if they are not sick, they have to come to be tested for different problems, like as I said, the BP, the diagnosing the BP, diabetes. So on the men's clinic, our men have the access to be receiving different services.
Usiku la lero ndi limene timakhala tikukumana ife azibambo uno ku chipatala cha Namandanje. Ndipo mwakutero uno ku chipatala cha Namandanje ndi kumalo kumene timakhala tikuthandizidwa komanso kuthandizika pa umoyo wathu komanso m'mabanja mwathu, kuti akhale mabanja athu osogola komanso moyo wathu ukhale otsogola. Choncho tikuthokoza inuyo a Dream kunena zonena zoti pamasiku amene takhala tikukumana kunoko, pamenenso koma masiku amene tikukumana kuno ndi kumene onera zoti tikukhala zoti umoyo wathu unasintha, si umoyo uja wakale. Zinthu zoti zimene timaphunzira kuno timazitenga pazisiya m'mabanja mwathu, ndipo mwakutero kuchokera pamasiku amene kuzafika lero mabanja wathu ndi osogola.
As the Bridge the Gap initiative unfolds in Balaka, the impact is clear. Healthcare services are stronger, communities are better informed, and hope is rekindled in the face against HIV and TB. The journey is far from over, but with continued collaboration and unwavering commitment, a future where every individual has access to quality healthcare is within reach. Together, we can bridge the gap, reduce disparities, and create a healthier, more equitable world for all.